for it. It's a different learning experience when you are in Taharat Mishpacha, when you are in the marriage, and you will certainly benefit from a review and from new ideas and directions. Okay, let's get to the questions that Kallah are asking. We will discuss three main topics in this session: scheduling the wedding, intercourse at the start of your marriage, and trying to introduce the topics of fertility and birth control. Those are huge topics. Within these three general topics, we will address the questions that many Kallot ask us, and also answer some of the specific questions that we received for this session in advance. Feel free to ask questions in the group chat or privately send us questions with that feature on this platform, and we will do our best to respond during the course of this session. I will now turn to Dr. Hellman. Welcome. Thank you so much for joining us here today. Like I said, our first topic is scheduling the wedding and cycle manipulation. So I guess the first thing is, how would you introduce this topic to Kallah? What would be your concerns? I want to give, before you jump into that, I want to clarify a little halachic background. I'm not assuming any knowledge on the part of our participants here. So a 1-minute review of Taharat Mishpacha. A married woman becomes nida when she gets her period. Okay, other things can make her nida too, but we're just going to talk about getting her period. She will then count a minimum of 5 days from when she first becomes nida. Sephardi customs are a little different, but I'm going to focus on the Ashkenazi custom right now. And then on her last day of bleeding, she needs to clean any remnants of her menstrual period and perform an internal examination to establish that the bleeding has ceased. This bedika, okay, this examination is called a hefsek tara. It gives her the green light to start counting her 7 clean days the following day. During the 7 clean days, she also needs to check herself, make sure she's not bleeding, and then she immerses in the mikveh at the conclusion at the 7th day of the 7 clean days at night. So if today is Sunday and a woman does her hefsek tara today in the afternoon, it has to be before sunset. Tomorrow, Monday, would be the first day of her 7 clean days. Next Sunday would be day 7 of her 7 clean days, and she would immerse in the mikvah next Sunday night, assuming all the checks go okay and there's no problems. The process is the same for Kallah before her wedding. She also has to check herself, do that hefsek tara. Even if she hasn't bled for a week, she still needs to do that formal examination to establish that she's not bleeding. There are some differences for a Kallah. One is she doesn't have to wait the 5 days. That's usually not a practical difference because often menstrual bleeding is at least 5 days, but that could be relevant. A second difference is that a Kallah can actually immerse during the daytime and not the nighttime. So sometimes a Kallah will schedule her mikveh immersion for the day after her 7 clean days conclude. There are even special circumstances when she can immerse on the 7th day, but that requires specific halachic guidance and usually is not the case. And third, and this is most relevant for our topic, and maybe Dr. Hellman will touch on this a little more, is that not only does the bleeding have to end and you have to check yourself and do the hefsek tara and count 7 clean days, there's an additional issue for a Kallah, and that is that the conclusion of her 7 clean days and her immersion in the mikvah, she should try to schedule them for as close to the wedding as possible. So she may have finished her period 10 days before her wedding, but she'll do her hefsek tara and count her 7 clean days closer to the wedding, up to 4 days before the wedding. So if your wedding is on a Sunday, then you should ideally immerse as close as you can to the wedding, but the latest you can schedule the mikveh immersion would be for Wednesday night before the wedding. The earliest you can schedule would be for the Wednesday night before the wedding. I'm going to pass on to Dr. Hellman. I'm going to add some points about this afterwards, some things that Kallah would have to consider, but I am going to turn the microphone to Dr. Hellman now.
Okay, great. Well, thank you so much for having me. This is what I love doing for sure, especially with this group of women, new Kallahs. It's a very exciting time. So I'll say that, this is one of the main questions that I'll get. It's like, hey, Dr. Hellman, like, how do I make sure that I don't have my period at my wedding? And so, really we kind of approach it with two main options, or three, I should say. One is we kind of look at the calendar of someone's period. What's your cycle? When do you expect your period? When is your wedding date? And does it look like you're going to be getting it during, you're getting your period around your wedding time, and we're kind of nervous about it, so we want to try to manipulate it? Or does it work out like, hey, maybe it's going to work out perfectly and we don't have to mess around with it? So that is one option that sometimes people forget about when they want to plan. It may actually just work out on its own. So sometimes it doesn't, right? And we're just a little bit nervous about it and want to feel like we have a little more control over the situation. So then there's two main options. One is to use a high dose temporary progesterone course, usually lasting about 3 to 4 weeks, that pushes off the expected period. Now, if that period is close to when the wedding date is, we want to make sure that we're going to be bleeding after the wedding rather than before, because remember, we have to make sure the bleeding is done not right before the wedding, but with enough time to get those 7 clean days and get to the mikvah and then get married. So we need the period before to be far enough away that can happen, and that the period, the bleed that's going to happen with the period is right after the wedding. So we can do that with progesterone. What progesterone does is it pushes off the period that's going to be close to the wedding. So that's number one. Number two is using a birth control pill, which is usually estrogen and progesterone combined. And when we use that, we can actually schedule the period. Instead of just pushing it off, we can schedule when we want the period to come. Now, there's advantages and disadvantages to both options. Many Kallahs will already be on a birth control pill, right? And then all we need to do is, hey, like, this works for you. We know it's working. You're on birth control for, whatever reason, medical reason. And so that's really helpful because, like, hey, we know you're already on something that you like. We can just kind of add a week, subtract a week, a few days here and there to put the period at the date when we want after the wedding. Some people have to think about maybe, if they want to continue contraception or birth control after a wedding. Is that something that you want to do or you don't want to do? And so that would also help us decide which option we pick. Using the progesterone to just push off the period helps with the timing. But then if you're interested in using any type of contraception or birth control afterwards, now we have to start that process. So sometimes that's a little easier to start beforehand. I say one kind of main topic or main kind of thing to think about also is, how soon are we having this discussion before the wedding? A birth control pill pack, which was that second option, is a month long, right? So if you are asking this question, like, hey, how do we do this? And it's 3 weeks before your wedding or 4 weeks before your wedding, we may not really have enough time to use more of a long-term birth control, but we can maybe use the progesterone to push off the period. So it's very, very helpful to have months to kind of make this decision rather than weeks. But again, we can always kind of try to work within the time frame that we have.
Mm-hmm. If it's very close to the wedding, and a woman is interested in starting with birth control because she wants to continue after the wedding, is there a certain dose that you recommend? I know there's different, doses in terms of the amount of estrogen in the pill.
Right. So if you're really close to the wedding, I'd say within a few weeks, we would probably just use the progesterone to push the period off. We usually give it's called Agestin. It's norethindrone is the the generic name. I like to use 5 milligrams twice a day. And the reason I like a twice a day dosing, which is every 12 hours instead of every day, is because at one point, if you have enough space between your pills, you may start to get a withdrawal bleed. So I like to really do the dosing, split it up every 12 hours so that your body never really gets a chance to withdraw and have some spotting that we're not really, we don't really want to have at that time. If we try to use a birth control pill that close to the wedding that has estrogen in it, I would definitely use more of a medium dose estrogen pill to try to prevent any spotting, because sometimes what can happen if our dose is a little low, and this is one of the things we think about when we're trying to work out what birth control works best for you, is find the right dose. And sometimes on a lower dose pill, we see a little bit more what's called breakthrough bleeding or spotting that you don't really want to be dealing with right before your wedding. So if we're really close, I like to give the progesterone option, and then we'll start a birth control after if that's something you'd want. It's most ideal to try to push that period off, to start it a little earlier than the second half of your cycle. So that's why I like at least 3 weeks of the progesterone. If we're starting it in the second half of the cycle, meaning the last 2 weeks of it, that's when it may not work. We're really trying hard to manipulate it, but we're also dealing with your normal hormonal fluctuations, and we need to make sure that we're at the right time that we can actually change things for that month.
Is the Agestin parallel to the Primalut Nor here in Israel, which is usually prescribed 5 days before the earliest expected period? Is it the same? Is it the same active ingredient?
I'm not sure. I haven't heard of that. I can look it up if you want.
Okay. Okay.
Yeah.
Okay. That's
Yeah.
there may be some, Kallah
It's possible.
participating,
Yeah.
and
The
they just it's
norepinephrine,
not used
yeah.
here.
And different countries have different names for their progesterone. So we use in the US, we use norepinephrine. So if that's what that is, then maybe.
Okay. So how early do you think a Kallah should start? Let's say she's getting, she got engaged, she has 4 months to her wedding. When do you think she should start? If she is interested in using birth control to manipulate her cycle, how early do you think she should start?
Yeah. So birth control pills, if that's the right route you want to go, as early as possible. If you're 6 months before, 9 months before, and you have that longer engagement, great. Like, we have time to work it out, because you have to think of each month is a dose, right? And so let's see what happens through 1 cycle, through 2 cycles, through 3 cycles. That's 3 months already. So we're kind of hoping that it will work right away, and we found the right pill, and we, found the right dose for you. But the more time we have to maybe work out little, side effects and try to make things better and switch doses around and progesterone types around, the more time is always better. I'd say, at least 3 months before is ideal. More than that is better, but less than that, we're already getting into a little worry of, well, if we don't find the right pill and we have lots of irregular spotting, are we causing more problems than not?
Mm-hmm. What are some of the side effects or other concerns what are you referring to when you say that?
Yeah. So with the progesterone, the Agestin, or the higher dose progesterone we're using just to push the period off, and it's used just for the cycle before the wedding, main side effects are bloating and mood changes. There can be some irregular spotting, but actually the way it's working is to try to prevent that spotting. So that's less often of a side effect that we see. But I'd say bloating and mood changes are the most common, and not everyone has those. So it's not like, oh, for sure, this is going to be you're going to have it, but that can happen. It's also a really stressful time. Like, it'll be a few weeks before your wedding. You want to fit into your dress, and you are super stressed out anyways, maybe with all the other details going on and just starting a whole new life. And now is your mood a little off, so can that contribute to it? It could, and that's kind of the caveat that we have to kind of give when we talk about starting hormonal manipulation.
Right.
The combined birth control pills, I'd say one of the main side effects is that breakthrough bleeding or spotting that can happen as your body adjusts to the new hormones it's being exposed to. And then also the similar side effects that we talked about before with progesterone only: bloating, moodiness. Sometimes people can get headaches. Sometimes that can actually take headaches away. So those are probably the most common ones. There are, and we can also kind of get into this a little later, but there can be some sexual side effects with birth control pills. That's why in general, I usually like to start on a lower dose one to kind of avoid those. Decreased libido or vaginal dryness are 2 of the main sexual side effects. Often not severe enough that would cause problems, at least for the very beginning of sexual activity. But again, if it's something that is a problem throughout, which again, I think we'll get into a little later, birth control is, if you're on something, is kind of something to think about, like, hey, maybe I should change this up and see if the problem gets better.
Okay, great. So
Yeah.
that's really important that
Yeah.
as soon as possible, if you know you're getting engaged in a month, it's not too soon to go visit and schedule your appointment
Not
with
at
your
all.
physician and get a prescription for a
Right.
low dose. But, in Israel, it's usually the doctors say not to go for the ultra low dose, which would be the
Right.
15 microgram, but a low dose, which would be 20 micrograms of estrogen. That's a good thing to start on really early and see how you react with it. Thank you. That's
Yeah.
super important. I just want to stick in two other points here. There are also kalot who choose not to manipulate their cycle
Mhm.
with birth control pills or with the progesterone. And in terms of scheduling the wedding around your period, without hormonal manipulation, you would want your period to arrive about 3 weeks before your wedding. Okay, that gives you enough time to go through the Tahara process that I described with no problem. You certainly have 7, even 8 days to get through your bleeding and do your Hefsek Tahara and count your 7 clean days. It also gives you a little time after the wedding so that your period doesn't come right after your wedding. Gives the couple a little time together, doesn't limit them too much, time to consummate their marriage without pressure. If your period comes, if your period is right, expected 2 days after the wedding, what happens if it arrives 2 days early? So giving yourself a week of leeway for expecting your period after your wedding would be good if you're able to schedule a wedding around your menstrual cycle. So I wanted to bring that in because I don't think we really brought that up.
Right. And that's exactly what I do with the birth control pill pack, right? Where we're trying to put the period where we want it, is get married in the 3rd week of the pack, right? So that the period's coming on the 4th week and the period's coming the week after the wedding. You've had enough time to get the mikvah. But that's exactly what we do with picking the period with the wedding date, as opposed to picking a wedding date based on the period. So you can do it either way.
Okay.
Yeah.
I want to bring up something that's connected to what you just said, which is if you are sort of manipulating your cycle hormonally, whether it's with progesterone or with birth control pills, you can fine tune it even more than a woman who schedules around her period, because we're going to get to that shortly. But when a woman when a Kallah becomes nida from the hymenal bleeding, she can take her last pill when she knows that she's nida. And then usually in reaction to her last active pill, 2, 3, 4 days later, she will then bleed. So she can really fine tune that post-wedding bleed. And what I usually recommend is if you're taking a 21/7 pill, meaning 21 active pills and 7 inactive pills, to schedule pill 21 for around your wedding or something like that,
Right.
unless you're taking a little bit more or that would be a good strategy. And then when you know your nida, you've taken your last pill, and then you should bleed 2 or 3 days later. And that way, the nida that results from the dam b'tulim, from the hymenal bleeding, coincides and overlaps with your nidut from the bleeding post-pill. Post-active pill. So that's also sort of a little manipulation that you can consider. Not only are you going to get to the mikveh before your wedding on time, but also so you won't have too much time as nida after the wedding.
Right.
I want to bring up something else that not everyone considers, but Dr. Hellman mentioned that there are women who have been taking pills for a long time, either because they had a long engagement period or they were taking pills for another medical reason. And many of these women are already doubling up packs, which means they're not taking 21 active pills and then 7 inactive pills. They could be taking 30, 40, 50, 60 active pills. I'll let you pipe in about that in a moment, Dr. Hellman. And what some of these women then choose to do is to schedule their bleed for 2.5 weeks before the wedding, so they have enough time to get to the mikveh before the wedding. And then instead of stopping the pills when they become nida from the dam b'tulim, she'll continue taking the active pills. And in that way, she will be able to get to the mikveh, hopefully, 11 days after she becomes nida, because a Kallah, when she becomes nida after the dam b'tulim, only has to count a minimum of 4 days and not 5 days. And that will sort of shorten the amounts of time after she becomes nida from the dam b'tulim to get to the mikveh sooner. I call that when I'm learning with Kallah. I call that Plan B, which of course only really works for Kallah who are comfortable with the pills already, don't have side effects, are not getting the breakthrough bleeding. Do you want to say something about what I call that Plan B option, sort of going
Yeah.
straight with the pills? Yeah.
Yeah. So, yeah, that we call that taking birth control continuously, which means just not taking the inactive pills and just constantly taking the hormone pills. And what that does is it prevents you from ever getting the withdrawal bleed that happens during the inactive pills. So we're trying to actually skip periods. And there's absolutely, when you're on a birth control pill, there's no medical necessity to actually bleed. In fact, some people this works great for, and they don't get a period ever until they take the inactive pills. And for some people, they actually start spotting a certain amount of time down the road. Is it going to be 5 weeks? Is it 3? Is it, 12 weeks? Is it 4 months, right? Everyone kind of has a different threshold of when they start to spot. And that's your body's sign that, you know what, like, it's time for a bleed. And then you can kind of turn that into a period. That's kind of a separate issue. But if you're able to do it for a long time and not bleed, and you can kind of easily predict that around your wedding time, that's not going to happen if you keep taking the hormone active pills, that can work really nicely. So then there's a lot less worry and stress. Am I going to have breakthrough bleeding? Am I not? Like, I know I'm not going to have any bleeding issues until I plan it. So that can kind of be really reassuring. It's not something I would start right away when you start and when you just start taking birth control pills. Usually it's good to take the birth control pills in the usual way, that it's the 3 weeks on, 1 week off, at least 1 or 2 cycles before you start taking continuously. Because if you are the kind of person who only gets 4 or 5 weeks straight and then you start spotting, you don't want to start spotting at a time that, like around your wedding, or messing up like when you're going to go to the mikvah. So definitely something not to do right away if you're just starting birth control for the first time.
Absolutely. Okay.
Yeah.
Thank you so much. We are going to move on to our second topic,
Yeah.
which I know is so important for many Kallah, for all Kallah really. And that is for those Kallah that are experiencing first-time intercourse, sexual experiences. They have a lot of concerns and questions, and it starts with, how will it feel the first time? Does it hurt a lot? Will there be a lot of hymenal bleeding? And I'm going to hand this right over to you, Dr. Hellman, to explain more.
Okay, good. Another favorite topic of mine. So, the over kind of arching theme of this topic is that everyone is different. So there's experiences you may hear about, but it doesn't mean that you're going to have them. So number one, just always keep that in mind. Number two, what is the hymen? The hymen is a membrane that was there when you were growing in your mother's uterus and you were developing as a female fetus, and it kind of covers the opening of the vagina. And then you're born, and sometimes it's a little open, sometimes it's not, but usually by year 2, so when you're a little kid at 2 years old, usually by then it actually will have opened. And why was it there to begin with? You're a baby, you poop, you pee, and things are not so clean down there, and it's protecting your vital reproductive organs, right? Like, just evolutionarily, like, hey, we got to protect the organs that we need to reproduce. So by 2, it's kind of open by then. And the membrane itself just kind of disintegrates and goes away. There's not a big traumatic experience of it being like torn open or anything like that. It just kind of dissolves and stretches away. Proof of it being open is you're getting your period, right? If blood is coming out of you, that means there is an opening there, the vaginal opening where the hymenal tissue is kind of opened and stretched away, enough that blood can come out. Now, how much of that is gone? How big is that opening? And that's, I think, where the kind of fear or nervousness of some of the hymen causing bleeding during first intercourse comes from. So the tissue itself, it's very elastic, it's very stretchy, and it does have the potential to kind of move aside at the opening of the vagina when something goes inside of it. So that could be first intercourse, that could be a tampon, that could be a tool that a gynecologist uses in a doctor's office and for an exam. So there are times when it has not, it's just stretched a little more to what its normal capacity is, and it does tear a little bit. And that is something that can happen. And when tissue in the vaginal and vulvar area tears, it can be a little painful. It could not be painful. There could be a lot of bleeding. There could be a little bleeding. And if there's a lot of bleeding or you see some of that, it could be bright red. It could seem like a lot all at once, and then it very quickly stops. That's pretty typical of a vulvar or vaginal tear. So it can look kind of scary, and then it just kind of goes away. The important thing is if you do see blood, which indicates that there was a tear, is to let it heal. So it may need a couple of days. And good news is tears in that area heal very, very quickly. So it may need a couple of days before, attempting insertion of anything again, if you are Anita from that, that's something that you probably are not trying to have sexual intercourse that again after that. So you do have that time to let it heal. But that's really where the idea of, well, is there going to be bleeding and is there going to be discomfort during first intercourse? Some people don't have that at all, right? So there could be no bleeding. And that doesn't mean anything's wrong. It just means that the tissue was stretchy enough that it didn't tear. And even if it does bleed or it does feel uncomfortable, that doesn't mean anything's wrong then either. It just means it needed a little bit of stretching to insert whatever size thing went inside of there. So that's kind of, I guess, my little overview of thinking about the hymen and sexual activity.
Amazing.
Yeah.
And, you said the first time that could happen. What about bleeding subsequent times? Is it common for there to be bleeding the second or third time afterwards?
Right. So if it hasn't healed, if that tear hasn't really healed properly, it definitely could reopen, just like any little cut on our body, right? Like if we irritate it again, it'll just start bleeding again. But, it may happen a couple of times. It may get better just after the first time or second time, that there's no like absolute number where I'd say, oh, this is a problem, this isn't. If something doesn't feel right, like if there's pain repetitively, and it's something that isn't improving over time, and you've kind of put your effort in, try different things, different positions, use lubrication. Those are all things that can kind of help that tissue not be, I guess, so traumatized with that insertion. Then, it may be a good idea to think about like getting checked out and say like, hey, why, I kind of expected this maybe the first time or two or three or four, whatever, wherever you're at. Let me just make sure everything looks okay, like from a doctor's perspective, or, is there something there that's not healing? Does everything look as it should? And that's kind of up to, I think, the individual couple, but pain in general is not something you should tolerate for a long time. So it's an indication that there's something that should be looked into.
Right.
Yeah.
I actually like to say to Kallah about that if they feel like like you said, they've tried different things, they've been encouraging each other, they're working on it, and they're spent, meaning they just don't feel like they have the resources anymore to deal with the discomfort. That's a good time. And for one couple, it could be after a shorter amount of time. For another couple, they're comfortable with trying for longer. It could take them a little longer to seek professional advice. So it's very, like everything you said, pain the first time, how much bleeding, it's very individual for the woman and for the couple. And, follow your gut instinct. If something doesn't feel right, then it's the right thing to seek professional advice.
For sure.
So that's great. Any other sort of tips or guidelines for your first sexual experiences together?
Yeah.
What to expect?
Yeah, I think another thing that's super important, I think we talked a lot about the hymen just now, but I think what's also important is to kind of educate yourself about your own anatomy, like especially in the genitalia, and kind of understand what the different parts on your body and how they're involved in enjoying sexual activity. And, one kind of important location would definitely be the clitoris. That is an external location on the vulva, the female vulva that when stimulated is usually the source of sexual pleasure. And, I think a lot of times in learning about this, we think the act of sex, which is penetration by a penis into the vagina is like the end all and be all, right? Like, oh, that happened. Great. We're done. But at the end of the day, we also need to understand that to have sexual pleasure as a woman, the clitoris is the main source of that. And that is external on our bodies, not internal. And so for both a woman to understand that about herself, for her husband to understand that about her as well, and kind of both of them kind of know, and that may kind of change what types of activities they do leading up to penetration that brings pleasure both to the man and to the woman. And so kind of knowing where that is on your body, and what its purpose is, I think it's really important. And also to really like going, further with that is to say, like, take away the guilt of sexual pleasure. Like I think a lot of us, growing up kind of in a more religious community are kind of, we don't talk a lot about sexual pleasure, and like maybe we can have little feelings of guilt about experiencing it or seeking it out or really trying hard to make that happen for ourselves. And that's Hashem put that part on our body for a reason, and it's okay to use it. And so that's something that I think we have to go into either a new sexual relationship, or, if this is something that has happened with you before, then with this new person. So wherever you're at with that, like this shouldn't be something you feel guilty about.
Amazing. And going back to what I said before, you have to find a great Kallah teacher. We didn't bring any diagrams here. We talked about it a little bit, but we had a lot of topics to cover, and we decided we didn't want this to be a biology class.
Right.
So you make sure that hopefully your Kallah teacher will be showing your diagrams and explaining. It is also helpful when you practice the badikot beforehand to learn the different parts. It also could be a way of seeing whether the hymenal opening seems a little tight, or if you're having problems with your badikot, see if you're figuring things out. That could also be like a sign that maybe you want to check things out a little further.
Right.
I'm going to add sort of a few more points about like sort of your first experiences. Don't feel so much pressure. Okay. It's not a test. Enjoy the time you're discovering each other. I really like a metaphor that I once heard. Learning to make love with your spouse is like learning to dance with a partner. Okay. When you first start learning to dance together, it may be awkward, it may be confusing, you may even step on your partner's toes, but it can still be fun, enjoyable, and even thrilling when you learn your first moves. It's true that as you progress in your dancing lessons, you become more skilled, you know how to work together and respond to each other, and dancing together can become even more pleasurable and even more thrilling. But that also doesn't mean that the first time you were learning together and your first dances, that those were bad experiences. It was new and fresh and exciting, and every encounter and every dance can be wonderful for a couple, no matter what stage they're at. So I think it's good to go in with a positive attitude. And another thing that I think is a tremendous advantage for a frum couple, one that doesn't have sexual experience, is that learning this dance together is a great gift. They can feel thankful that they're learning it together in a relationship based on exclusivity, commitment, love, and mutual respect. The process of learning the dance involves a lot of goodwill and interpersonal skills. Includes sensitively and patiently communicating what you both want. Like Dr. Hellman said, feeling good about the pleasure that you're receiving and the pleasure that you're giving. It is a great gift from Hashem that Hashem made our bodies that way, and that we can bind to each other in that way. Being sensitive and understanding and responding to the needs of your spouse. The whole process can be, very meaningful, enjoyable, and hopefully will really create a tremendous bond for you. I also want to address a question that, just in a sentence, I hope this answers the question that that was submitted to us before this evening. It's nighttime here. And that is, someone asked a question about sexual compatibility. And basically, if there's a basic attraction and the couple are in a caring and loving relationship, then sexual compatibility will flow from there. If there's a problem, then either something in the relationship or the basic attraction is not there, like I said, or it's something physiological or psychological and not really a case of sexual incompatibility. It definitely should be address, but I don't think it's because these two people are not right for each other. There could be other reasons, and then, you know, they need to take care of that. One other thing I wanted to say a little bit about the Tam Batulim, and this is definitely something that's hard for kalod and for couples, that it's a very tough halacha for a new couple, that when they consummate their marriage, the hymenal bleeding makes a woman nida. This halacha is based on a gezerah of Chazal. I'm not going to get into the details or the background of the halachot here, but it's a tough one. It does have a little bit of a medical advantage. I'm not saying that that's why the gezerah was made, but like Dr. Hellman said, giving your body a little time to heal is probably smart in any case. That doesn't make it easier for the couple emotionally and physically to think about the healing, but it is a little advantage. One person submitted this question before the session last week, and asked about the socially constructed concept of virginity. And I have to say that the concept of virginity, which basically in our culture means that this woman or man has never had penetrative intercourse before this moment, that concept of being virgin is not connected to the gezerah of Dam Batulim. To the extent that it's possible for a woman who's not technically a virgin to become nida from Dam Batulim, it's possible for one who is a virgin not to become nida from Dam Batulim, meaning there's all kinds of possibilities. Again, I don't want to get into the examples, but those are.
I think you froze a little, Hadassah. All right, let's just kind of wait a little bit till she comes back on. All right, guys, just one reminder while we're waiting for her to come back on, maybe if you can put any questions into the chat, then we can kind of get to those at the end. All right, I think she's getting there. Just bear with us one more little bit. Isn't the tech part of this fun? Okay, as soon as we get her, oh, here she is.
To close it and reconnect. Thank you for your patience.
You're there. Okay. I just reminded everyone that their questions.
All you, Dr. Hellman. So,
okay.
Just what I was saying before is that the idea of being a virgin and the gezerah of Dam Batulim are not connected to each other. And I think that the most important point here is that the world of halacha operates independently. We should not be imposing concepts or ideas or worldviews outside the realm of Torah and then impose them onto the world of halacha. Tuma and Tara, mutter and asar, permitted, forbidden, dam nida, dam batulim, these are halacha categories, and a commitment to halacha means we live Jewish lives according to these categories. Sometimes it's interesting to compare how biological concepts compare to nida concepts, or how other ideas in our culture compare to nida concepts, but we really need to be careful not to equate them with Jewish ideas. So that's sort of my response to that. I want to move on to our third topic, which is actually the biggest topic, but we'll try to say something meaningful and useful, and that is fertility and birth control. Dr. Hellman, can you just give our kalot some general advice and guidelines regarding fertility awareness, preparation for pregnancy, planning a family?
Yeah, definitely. Huge topics we could talk hours and hours about. We'll try for 10 minutes. So, the number one, I say most important thing when it comes to fertility awareness is understanding your own cycle, right? Like every woman really has a very different cycle from the next woman, and kind of knowing what is your normal and what you experience on a month-to-month basis can really help you understand when is your most fertile time of your cycle, or if it's hard to figure out, is it something you maybe need to see a doctor for to help learn about it or to identify any problems. So in general, really quick lesson, we'll use a perfectly average 28-day cycle. Okay, and we know not everyone has perfectly average, exact, but using that as kind of an example, usually day 14 is the day you ovulate. And what is ovulation? That's when your ovary pops that egg out. And if you have sex around that time and there's sperm inside the vagina that climbs up into and swims up into the uterus and it sees that egg and it fertilizes it, that is when pregnancy can happen. You ovulate only once per cycle. Most of the time it's just one egg. Very rarely, it could be more than one. That's how you end up with fraternal twins. But that egg lasts in you for about 1 day. So if there is, that's really the main time in the cycle that you could become pregnant. So if you consistently get your period around the same time frame every month, you can kind of consistently track when your ovulation is. It's when you start having unpredictable cycles. Are they irregular? They're coming every 2 months, every 3 months, 40 days, 35 days, and kind of jumping around there. That is where it may be a little harder to predict when you are ovulating. If, you have months and months between cycles, that's something to see a doctor for, because that indicates that maybe you are not ovulating every month. The best indicator, we kind of, in our OBGYN world, we say, a period is one of a woman's vital signs. And we can tell a lot about what may be going on in the woman's body with fertility, with how she's doing, kind of clue us into, are there any maybe medical issues we should be looking for if the cycle is a little bit off. So it's not a bad idea to have a conversation with the doctor and say, hey, you know what, like my periods come every 2 to 3 months. Maybe we should like look into, is there a reason for it? Is there something I can identify and maybe be able to fix or make it a little bit more predictable for me to figure out? Looks like Adasa got a little disconnected. We will keep going though, because I have a lot to say. Another thing to kind of think about with birth control is like, what are your goals, right? Like if you do not want to become pregnant, or if it's not the right time for you guys, to think about how long are you interested? Sorry, while you froze a little bit, we started talking about birth control. So, birth control is important to think about how long are you interested in preventing pregnancy, because that can really determine what method you use. Are you just looking for a few months? Are you looking for a few years? What medical reasons may you have, both in yourself or your family history, where one birth control may be a little safer than others? So these are all kind of the considerations that we take when discussing like what birth control method may be good for you. Are you good at taking a pill every day, or are you forgetful? That's okay. Everyone's forgetful, right? So maybe something like that needs an everyday responsibility isn't great for you, right? So we kind of take the whole lifestyle, the whole medical history, what your goals are for kind of deciding what type of birth control or what may be best for you. And then also, if you are interested in becoming pregnant, what do you need to do to prepare yourself for that, right? Like you are now, like you want yourself to grow a person, right? How are you going to prepare your body so it can do that best and most healthy? And so things like taking prenatal vitamins before you become pregnant, right? Because we need that good folic acid to prevent birth defects that can happen even before you would know you're pregnant. Running, if you're on any medications, running them by your doctor and making sure that it's okay to stay on these while you're trying to get pregnant or when you're pregnant. Lots of different, if you have any, blood work that's being followed, or medical issues, make sure they're optimized, make sure you understand the impact that they would have on a pregnancy, or the impact a pregnancy would have on you, right? Same with mental health considerations. Make sure that you feel in a good place headspace wise to, enter into this very, very new, physically taxing, mentally taxing part of your new life. And, lots and lots of things to think about. We think of like, oh, get married, have a baby, but, there's a lot to think about to really like feel like you're doing this in the most healthy way for you. So I think those were kind of the main talking points. There may be more that I'm forgetting about that I can talk a lot about. So, age, you were going to talk about that.
Yeah, there was a question that came in also in advance. A woman who was getting married, she's 30 years old. She was concerned about her fertility. Do you have any advice about sort of maintaining fertility, planning a family responsibly at this age?
Yeah. So, their fertility definitely declines as a woman gets older, right? That's just kind of a medical fact. And, we usually start to see that decline in the mid 30s. Sometimes it can happen early 30s. And so what we want to do is kind of have that fertility awareness. Like, hey, what are your cycles like? Like, do I know when I'm ovulating so that when I'm ready to get pregnant, and just because you're in your mid 30s doesn't mean you have to try getting pregnant right away, right? I think some people do feel that pressure of like, oh, I may be starting out this phase of my life a little bit older where feel the crunch. But again, if you need that few months to feel adjusted to marriage, or, you need to like work on any potential medications, or just make sure you're doing the safe, that's okay too, right? The mental part of it definitely matters. But if you are feeling that crunch and you're like, hey, I want to get on this as soon as I can, I'm totally ready. Like, we are ready, we're excited. Again, that fertility awareness is really important. And also if you have been aware of when you're ovulating and you've been trying to get pregnant for 6 months and you're not pregnant, that's when it's a good idea to start seeing a doctor and say, hey, you know what? I want to be on top of this. Doesn't mean anything is wrong, right? Sometimes it can take up to 12 months to get pregnant. About 92% of couples will get pregnant within a year of trying. But sometimes it can take a little while, right? Like, what if you're the person who had 11 months is the success story, and at 10 months you're starting to get worried? Okay, like most of the time it happens, and that should be reassuring. But if, again, we're doing our fertility awareness, if we kind of think in the back of our minds, I'm a little bit irregular, or I have this medical issue, or I'm on this medication, or I have this history of some type of surgery that may affect your fertility, we should talk with the doctor to plan our map of what road we're going to go down if you're not able to get pregnant easily. And sometimes just having that plan of like, okay, at this point, we'll start doing some blood work. At this point, we'll start doing some ultrasounds. At this point, maybe we'll start intervening with some medication that helps fertility. So just having that plan can be really helpful when you're starting out this process a little bit later. And that's kind of, I think, really reassuring as to like, you have the little bit more sense of control over something that you thought was going to work out perfectly, but maybe isn't. And so that can be really helpful too. But overall, look, there's some 20-year-olds who have difficulty getting pregnant, and there's some 40-year-olds who get pregnant right away, right? So remember, there's still this individual experience, and not everyone fits into a perfect mold based on what number of years they've been here for. So I think we also have to remember that too.
Right. Okay, thank you so much. This session, we are not addressing the halachot of puravu, the myths of having children, especially when a couple is first starting out. They should seek halachic advice regarding delaying having children. There are also halachic issues with different birth control methods, which is also not the topic of our session. Dr. Hellman has really been addressing, the medical issues and fertility awareness, education, a little bit about birth control. There are sessions in this conference that deal with puravu, that deal with birth control, that deal with fertility. Any of you who are more interested in any of these topics, I encourage you to enter those sessions as well. We're not touching on that now. You may also learn about it with your Kallah teacher. So I just wanted to bring that in. One specific question that was submitted in advance. This is, you see that the people who submitted in advance have a little advantage here. If a woman is choosing to put in an IUD, and it's okay if she needs it for a certain amount of time, maybe she can't take hormones. The woman in her question said she was going to put in a Paragard, which is a non-hormonal IUD, a copper IUD. So perhaps this woman is someone who needs a reliable form of birth control that's non-hormonal, and she wanted to know when before the wedding would be the right time to put in the copper IUD.
Yeah. So remember, the copper IUD, since it has no hormones in it, the way it works for birth control is it creates kind of a mild inflammatory reaction within the uterine lining that is very inhospitable to sperm. So sperm does not like living there, so it will never get to an egg well, I should never say never, but will not get to an egg to fertilize it. So that's how it works for birth control. Since there's no hormones in it, you cannot use the Paragard IUD to manipulate your period. So when you get that placed, you also, as far as timing of your wedding, you'd want to get that done months before your wedding. I'd say at least 3 months, if not more, because sometimes even with the non-hormonal IUDs, you can get kind of unpredictable bleeding as your body just kind of starting with that uterine lining being a little irritated. Do you have a little bit of breakthrough bleeding from the insertion itself can cause a little bit of tissue trauma that causes some spotting. So you want to make sure that you don't put it in right before the wedding and now you have all this bleeding. So I'd say at least 3 months before. And then you're going to want to also make sure that your wedding date, right, is not falling out right around your period too. Because again, you're not using the copper IUD or Paragard IUD to control your period. So you could do that progesterone, like pushing off your period, like we talked about.
Progesterone could work.
Yeah, and I'll also say, like, this is just totally just me just throwing this information out there that I learned by talking a lot more with people in Israel. There's like lots of different copper contraceptive devices that go inside the uterus that is offered in Israel that is not offered in the States.
There are different things on the market here.
Yeah, so it's interesting. There's a lot of
the concept is the same, that it's a non-hormonal form of birth control, which some women need or want, that they're not comfortable with the hormones or it doesn't interact well with something else. I mean, my takeaway from our discussion is really the earlier the better. It goes back to the very first thing I said. Get to the doctor, take a personal medical history, make some decisions. What you want, how you see your future in terms of planning your wedding date and birth control use. So you really need to get to the doctor as soon as possible. Thank you so much.
Yeah, no problem.
Let's see, we have a few minutes left.
Yeah, there's a couple of questions in the chat, I think.
Okay, so are we seeing a question now?
One is, I think is a really awesome question.
Okay.
I'm sorry to like jump in. I know you were doing the moderating.
No, perfect.
This is wonderful. When do you include your chassan in the discussion of psychomanipulation? And I think that's a really great question. And I think one that many Kallah really struggle with because, is your engagement shorter? Like, how long did you date? And you've decided together your life is compatible with each other and you want to start a new life together, but it still may be really hard. And it's not just psychomanipulation. It's talking about sex. It's talking about pleasure. It's talking about periods even, right? Like how are we used to talking about periods with the men in our life? Probably not. So I think, to answer this question specifically, I definitely will let you do it. But from my perspective, understand that the psychomanipulation in the wedding does affect both of you, right? Like if you're not able to touch and have sex, neither is he, right? So it's something to kind of talk about, like, hey, this is something I'd like to do for us as a couple, and this is my options of how to do it. Do you have any input? I wouldn't go with the approach of, is it okay? Is it not okay? Or, after both getting your kind of like rabbinical halachic advice, but like, this is something that I'd like to do for us, or is important for us, kind of like include him in that kind of conversation.
I also think that each Kallah has to do it in the way that's comfortable for her.
Right.
Okay. Yeah. Sorry. lost you me for a second. Do it in a way that's comfortable for her. I mean, there are
Mhm.
stages in a relationship. It's definitely true that once you get engaged, things shift, and the conversation between you may move to topics that you did not encounter in the past.
Right.
And if you're planning to go even before you get engaged, you may choose to share it at that point. You may just want to get a medical consult, medical history, a prescription, and then discuss it. Sometimes I encounter kalot that have thought a lot about it and even have a plan, maybe even discuss it with their chatan, but still haven't made the doctor's appointment.
Right.
So, and it can take time to get that appointment, and it
Right.
has to fit in with your, if it happened a week after you got your period, you then have to wait another 3 weeks till you get your period.
Right.
So again, schedule that appointment, get the medical history, um, get some advice. You don't necessarily have to start taking it immediately. You don't necessarily have to make a plan immediately, but you do have to get to the doctor's appointment. I keep on
Right.
getting back to
Yeah.
that. I wanna. Do you have something else that you want to add here? I want to do a little wrap up. We have 2 minutes left.
Yeah, I mean, look, with all these discussions and all these topics, I think it really comes down to being aware of your body and your cycle and being aware of the timing that you are in as far as wedding and periods. And it's just a general awareness. And I think, you're in this like super busy, exciting, sometimes stressful, exhilarating time of your life. And it's not just about like, what flowers do I have at my wedding and what does my dress look like? And like, my new sheitel or whatever, wherever you're at with that, those are details for the day, right? You need to think about and be aware of like the importance of what you're coming into, like your life, your cycle, your contraceptive needs, your pregnancy plans, and kind of think about that as like one of the most important things, because that's what matters when it comes to your daily life and your daily like
Marriage
new life with this person.
and your
Marriage,
marriage.
exactly. And you'll look at your nice pictures 10 years down the road from now, be like, hey, like that dress looks like it's out of style now, right? So you like the really, really focus, like make it a priority to focus on you and your health, just like you do with all the external details of your new life.
Okay, thank you.
Yeah.
And okay, I just want to add that there are so many resources available for you. It's amazing that you joined this session, and I complimented you all at the beginning about that. Continue learning, continue reaching out. It's not just the first doctor appointment. It's not just your Kallah teacher. Find out where you're living, if there's a Yoetzet Halacha there, who the women like, what Rav they like consulting with in your community. There's the Nishmat hotline. I mentioned that I work on the hotline. Nishmat has a wonderful website. There's so much information there, the Health and Halacha website. You can submit anonymous questions. The hotline itself is anonymous. So there's so many resources for you. I'm so used to getting questions from engaged women, new Kallahs, calling me, asking me anything and everything. And it's so important to know that you can continue asking questions and, of course, continue learning. I wish you a big mazal tov.
Yes.
Thank you for joining us. May Hashem bless you with a long, healthy, and joyful marriage.
Amen. Thank you, everyone.
Thank you so much. Hi, Alyssa. Do you hear me?
Hi. Yeah.